My name is Gabriel Funingana. I'm a medical oncologist and clinical research fellow working at Cambridge Cancer Center.
So my name is Elaine Leung. I'm an academic clinical lecturer in gynaecology at the University of Birmingham. I am the lead for DEMO, which aims to improve genetic testing and uptake and success rate between Birmingham and Cambridge. The project is really about reducing inequality in terms of biopsy rates and also differences how we treat patients of different ethnicity. Women who do not speak English as their first language often don't have as much information about genetic testing. We also know that biopsy quality varies across the country, and it's really important to look at that because in the era of genetic testing in the context of cancer, that really changes survival for patients with ovarian cancer.
We had three aims. One was to improve the information we provide to the patients.
Diversity in patient involvement is really important. When we spoke to different patient groups with really different composition between Cambridge and Birmingham, actually the ideas is really different, but by bringing them together, we reach the consensus that is actually make the information we produce and the idea we have much more accessible to a much wider group of patients.
The second was to understand about the diagnostic pathway. So what are the real steps that actually need to be done in order to improve access to genetic tests, from collection of more tissue to actually improve the turnaround time of the results. And the third part was actually to expand our project and actually start to share this knowledge with more hospitals, more team, and this was done through a national collaboration with the British Gynaecological Cancer Society, so wanting to improve as well the national guidelines about molecular testing. We have achieved these videos that will actually improve how patients will understand the role of genetic testing. These videos can be used as well for the clinical team to actually improve the turnaround time of the test because they can offer the information prior to having a consent discussion, so we'll reduce that time frame. Secondly, by understanding about the diagnostic pathway, we actually now know about the variations, geographical variation or other variations nationally, why patients are offered or not genetic tests, and then we can understand what are the next steps that are required really to improve the diagnostic pathway. And the third, by having these guidelines, we aim to actually spread the word and the knowledge that we have built up in this collaboration, and hopefully will help not only patients diagnosed with ovarian cancer in the UK, but patients diagnosed with ovarian cancer in other countries as well.